We are going to study the ear, that is Shrotrindriye. So first of all, the ear is divided into three parts: external ear, middle ear and internal ear. Today we are going to discuss the external ear. External ear has two parts: the auricle and the pinna, auricle or the pinna, and second is external auditory meatus. External auditory meatus. So first is auricle. What is auricle or the pinna? It is the part which is seen on the surface. This is auricle or pinna, which is the part which is seen on the surface. किससे बना हुआ है ये? It is made up of the crumbled plate of the elastic cartilage. Second point. The third point is how many parts of this pinna are there? There are so many parts of the pinna. The first is the outer part is known as the helix. और इसके अंदर एक और कर्व जा रहा है. This is known as antihelix. This prominent portion in the anterior aspect is the tragus. The posterior part, on the posterior part there is antitragus. There are three fossas. सबसे ऊपर scaphoid fossa, उसके नीचे triangular fossa, and this fossa is known as concha, which is leading into external auditory meatus, right? And there is one tubercle which is situated on the upper part on the antihelix, that is known as Darwin's tubercle or the auricular tubercle. The lowest part of this auricle or the pinna, which is made up of the soft fibrofatty tissue, it is known as lobule. It is made for wearing the earrings, right? And there are also muscles present in this auricle or the pinna, but all these muscles are vestigial in the humans. They are all working in the lower animals, right? Now the blood supply, for the blood supply and for the nerve supply, the blood supply is by posterior auricular artery and superficial temporal artery. Posterior auricular artery and superficial temporal arteries. For nerve supply, we will divide this pinna into two parts: the lateral surface and the medial surface. And the lateral surface and the medial surface will divide it again into upper 2/3 and the lower 1/3 part. The lateral surface, upper 2/3 part of the lateral surface is supplied by auriculotemporal nerve. The lower 1/3 of this lateral surface is supplied by the great auricular nerve. The upper 2/3 of the medial surface is supplied by the lesser occipital nerve. The lower 1/3 of this medial surface is supplied again by the great auricular nerve. So this is the lateral surface nerve supply and the medial surface nerve supply. Then there is a root of the auricle, जहाँ पे कान हमारा जो पिन्ना है वो जुड़ा हुआ है. Root of the auricle, it is supplied by the auricular branch of the vagus nerve. Then the muscle, the auricular muscles are supplied by the facial nerve. So this is the blood supply and the nerve supply of the auricle or the pinna. Now the lymphatic drainage is by the pre-auricular and the post-auricular lymph nodes, right? The next part is after auricle or the pinna in the external ear is external auditory meatus. What is external auditory meatus? It conducts the sound waves from concha to the tympanic membrane. Concha, this is concha, and अंदर की साइड क्या होगी? Tympanic membrane. So this external auditory meatus is for conduction of sound waves from concha to the tympanic membrane. Now what is the shape of this external auditory meatus? The canal is S-shaped. The canal is S-shaped. So how it is S-shaped? First part, the outer part is directed medially and outwards. Then middle part is medially and backwards, and the inner part is medially and forwards. Medially forward, medially backward, and then again medially forwards. So that is why, because of this S-shaped nature of this canal, for examination of the external auditory meatus, we have to pull the pinna upward, backward and slightly laterally in case we have to examine the external auditory meatus. Now what is the length of this external auditory meatus? The total length of this meatus is 24 mm. कितनी लेंथ होती है? 24 mm लेंथ होती है. इसके दो पार्ट्स हैं, the lateral 1/3 part and the medial 2/3 part. The medial 2/3 part is bony and the lateral 1/3 part is cartilaginous. Means it is made up of cartilage, and this medial 2/3 part is made up of bones. Total length is 24 mm. The bony part has the length of 16 mm. and the cartilaginous part is 8 mm. Right? 24 mm, this is 16 mm, and this is 8 mm. Right? So this is the length of the external auditory meatus. Now what is the now you see the anterior wall. This is the anterior wall, this is posterior wall, this is the roof, and this is the floor of the external auditory meatus. Now our tympanic membrane is not straight, it is placed obliquely in such a way that the anterior wall and the floor of the external auditory meatus are longer than the posterior wall and the roof. Right? Now next point is section में कैसा दिखाई देगा ये? The canal is oval in section. The canal is oval in section. और इसका जो bony part है वो ज़्यादा narrow होता है और cartilaginous part कम narrow होता है. Right? The narrowest point इसका नाम होता है isthmus. Narrowest point को हम बोलते हैं isthmus. उसका distance कितना रहेगा? 5 mm from the tympanic membrane. Tympanic membrane से 5 mm की दूरी पे जो point पड़ेगा वो सबसे narrowest point होता है हमारा. Right? अब हम इसके दो पार्ट पढ़े हैं ना, बोनी पार्ट एंड कार्टिलेजिनस पार्ट. तो बोनी पार्ट है तो बोनी पार्ट भी किससे बना होगा? बोन से बना होगा. तो कौन सी बोन से बना होता है? बाय द टिम्पैनिक प्लेट ऑफ द टेम्पोरल बोन. बट दिस टिम्पैनिक प्लेट ऑफ द टेम्पोरल बोन इज नॉट कंप्लीट. It is not complete. Its posterior superior part is deficient, and this posterior superior part is fulfilled by the squamous part of the temporal bone. So tympanic plate is C-shaped, and the rest posterior superior part is fulfilled by the squamous part of the temporal bone. And this bony part is lined by the skin, which is firmly adherent to the periosteum. इसीलिए यहाँ पर कोई भी infection वगैरह होता है या कोई भी फॉरेन बॉडी जब इम्पैक्ट होती है तो वहाँ बहुत पेन होता है, क्योंकि यहाँ की जो स्किन होती है वो फर्मली एडियरेंट होती है पेरियोस्टियम से. इसी तरीके से ये कार्टिलेजिनस पार्ट है. दिस कार्टिलेजिनस पार्ट इज मेड अप ऑफ द कार्टिलेज, बट दिस कार्टिलेज इज ऑल्सो सी शेप एंड दिस गैप इज फुलफिल्ड बाय द फाइब्रस टिश्यू. ओके, हियर इट इज ऑल्सो लाइन्ड बाय द स्किन which is firmly adherent to the perichondrium, just like as in the bony part. And here the skin also contains the hairs, the sebaceous glands, and the modified sweat glands, which are known as ceruminous glands or the wax gland. Okay, and in the last we will write down the functions of the external auditory meatus. The first function I already told you, for the conduction of sound waves from concha to the tympanic membrane. The second is it protects the tympanic membrane, and third point is it maintains the humidity and the proper temperature. Clear? So this is all about the external ear, the auricle or the pinna, and second is external auditory meatus. In the next class we will discuss the tympanic membrane.